My name is Harrison Smith. Here, I want to talk about the assessment techniques within the OPT model. I find this to be the most important technique when it comes to assessing an athlete and going for performance goals. Peter Drucker says, working on the right things is what makes knowledge work effective. He is a management consultant and he knows about getting the right things done. Okay, if you're not working on the right things, you want to accomplish your end goal. Clark states, assessment training is a systematic approach to problem solving. In doing so, this provides a professional with the basis for making educated decisions about the acute variable selections. Okay, we have to know, if we want to grow somebody, we got to know the right variables to use. To begin, the coach must know the goals and the needs and the abilities of the athlete. In doing so, we come up with 4 different assessments. We have a medical assessment, which gives us the information of chronic and past situations, allowing us to know if the athlete is able to go or not. Then we have the physiological assessments. Okay, this just pretty much gives us information on heart rate, blood pressure, body fat, etc. This gives us the overall status of our athlete, allowing us to be able to construct a conditioning system. Then we have the postural assessments. Okay, movement is depending on structural integrity and alignment. Rhinehart and colleagues concluded through their research that a movement assessment used to properly locate and classify any movement dysfunction. This allowed them to go ahead and set up an interventional approach towards their training. Okay, you have to know what you're looking for if you want to know what to fix. This was further backed up by Oliver and colleagues who researched several movement assessments specifically as it pertained to hamstrings and gluteal muscle groups and movement. Specifically, they were looking for the glute medius, since its function is to stabilize the pelvis and the femur within the frontal plane. They concluded that the most efficient assessments in identifying the glute medius was the single leg step down test and the single leg lateral hop test. Knowing this information, you could see what's out on the athlete and we can further advise a program that could fix these components. Okay, if not doing so, you can definitely screw up the athlete. We could have altered tension, altered coupling, and altered joint kinematics. This can all lead to these issues that we see right down here: altered sensory integration, altered neuromuscular efficiency, tissue fatigue, and then further perpetuate within inside the injury cycle. Okay, the next we have is the performance assessment. Okay, for the athletic ability, we need to look at stability, strength, power, speed, agility, quickness, and conditioning. This will allow us to be able to program our specific needs towards a specific athlete for the specific sport. Together, these assessments will allow us to accumulate a bunch of information to further have a better idea how the body is working. Okay, the body will only adapt to the demands that are placed on it. This is the SEDS principle, specific adaptation to impose demands. We must know what our athlete is at, and we must know where our athlete wants to go to be able to do so. Look no further than the analogy of a map. If I'm here at point A and point B, I know my direction to get there. But if I know where point B is, but I don't know where A is, I can start where all over and just hope that I end up somewhere, probably not going to be where you want. So the coach must find the proper base to plan from and program the variables to build upon that foundation. The program you design for your athlete is only as good as your assessment.